Let's head to Taraba State, where the state governor Darius Ishaku has assured residents of his unflinching desire to eliminate the existence of hepatitis in the state by ensuring adequate testing and treatment of carriers to avoid loss of lives. The governor, who revealed how his administration spent billions of naira to treat the ailment in 6 local government areas, described the disease as a silent killer, which has attracted less attention. To assist him in the fight against the virus is the World Hepatitis Alliance, an organization which has donated drugs worth over 40 million naira to help reduce the epidemic in Taraba State. Viral hepatitis is one ailment that has over 18 million Nigerians affected. Taraba in Nigeria's northeast is one of the states in the country experiencing the highest burden of the viral hepatitis B and C, with an estimated number of over 250,000 residents as carriers. This ailment has claimed several lives in the past due to lack of functioning laboratories. But today, with the advent of such labs in the 3 senatorial districts by the state government, a resident says it's a welcome development.
Many people are having it, but they don't know whether they have it or not. Like my experience, I have been tested negative. I took 3 months injections. After all, at the end of those injections, I went back to the hospital, and I've been tested still negative. So I'm using this medium to call on the general public to avail themselves the opportunity of knowing their status. By knowing one's status can reduce the risk of death.
The President World Hepatitis Alliance, Danjuma Ada, pays an advocacy visit to Governor Darius Ishaku. He believes that without putting in the right commitment, the target of eliminating the virus will be fictional.
Because of the lockdowns, people could not access hospitals. People could not access the free community testings we do. So that really compounded a lot of problems, and even disruption in supply chains. People that's supposed to be on medication could not access drugs because supply chains were broken. They couldn't travel to hospitals. So we are yet to see the impact of the delayed diagnosis during lockdowns on the health of the communities.
For Governor Ishaku, he assures the people of more laboratories in the state, even as he appreciates the diaspora donors for supplying the curative drugs.
We now have testing laboratories in the south, in Takum, and one here in Jalingo. And the beauty of our laboratories that they have been so enhanced now that they are not only testing hepatitis, they are testing HIV, they are testing COVID, etc. You add to it well-equipped laboratories.
It's expected that with the provision of more laboratories in Taraba State, testing and treatment will improve to help save lives of residents, especially those in the local government areas badly affected.